Health Hats, the podcast. So maybe my perception isn't accurate, but my perception is there aren't very many such people here at this conference. So why do you think that is? It's like we have these panels and there's scientists up there, but where's the implementers, the people that are doing the implementing?
Yes.
Why do you think why do you think there aren't more?
I think in general, for one to be able to attend this conference, you have to, in many instances, you have to submit an abstract.
Okay.
People working with NGOs, and not many of them are necessarily scholars. And so you may have instances when it could be that not many of them are even applying to come here. But also it could be that the organizers are not making much effort to reach out to those who are implementing and not necessarily waiting for them to submit proposals. Because we can be very intentional about bringing some people on board, but also we can open up opportunities for them to apply. So I do think there's a good thing in this conference in the sense that they sometimes bring in advocates. They give some opportunities for some few advocates to come. But if we can have more practitioners here, I think it will be a very good.
I think this conference in particular focuses more on the science. There are other conferences that focus on the implementers. And I do think there's opportunity to bring in, I know yesterday there was a meeting with industry partners to figure out where the gaps are between industry and academics and try to figure out where a partnership could happen. Bring in a little more rigor to what's happening in industry currently.
And so how do you define industry?
Well, yesterday it was the partners that I know of were pharma, so that like bigger industry. But I do, from your perspective, community organizations and things like that, I think that's an opportunity for future meetings to bring in and have a meeting. I do think it's a little challenging because the context varies so widely. We work in Colorado, and where we sit in Denver is highly metro urban area, but most of Colorado is rural. So we need to make sure in our partnerships that we have a very diverse set and potentially different partnerships. It might not even make sense to mix them in some cases.
I think there's not more implementers because there isn't one, it's super expensive. This particular conference is expensive for me.
Expensive in terms of the registration, the travel, lodging, that kind of stuff?
Everything, So comparatively to some other conferences that I attend, the registration for this one is quite high. But I think also, as I'm thinking about conferences and have attended something else this year that was intended to bring together researchers and community partners and funders too, for that matter, what I noticed was that there wasn't really a track of learning or engagement that was really beneficial for the community partners. So when we look at the conversation topics, they're mostly centered about research methods or on results, and they're intended to be communicated to a scientific audience. And so I think if we're going to have more effective collaborative meetings, we need to be designing for that intention. And if we're going to invite community partners, there need to be laid out conversations and expectations that people are paid for their time, that their travel is compensated, and that there's a win. There's a reason and a benefit to attend that could help them build their nonprofit, that could help them develop more effective collaborations, better understand perhaps the research process that the researchers have spent a long time learning, but how can you better develop those collaborative conversations? And if there isn't a win, why would you attend?
What I found in talking to a lot of my colleagues that have been involved in different projects and programs over the years is that they don't realize that's what they're doing. And so they don't recognize that conferences like this are for them and about them. They're a bit disconnected because it's not been put to them yet that this is exactly what you're doing. It's interesting to me that implementation science now is 30 years, several decades into it. And even the most schooled and knowledgeable experts don't know at all. We don't all have the answers. And we haven't been able to communicate it in a way yet that I think people understand that they are doing implementation science and they are doing the implementation work that needs to get done to take great ideas that we know can be successful and to put them in place and not put them in place in one location, but to make them scalable and sustainable. And I think if they realized that's what they were doing and they had, once they recognized that about themselves, they would see it in others and be able to work together with them so that we could make not just local change, but larger system change through implementation.
And I'll tell you, this is probably the premier or one of the premier implementation science conferences, definitely in the US and probably worldwide as well. Part of it is that it was established by researchers.
Okay.
And it was established by research funders and people who have degrees in the field. And so it started off and has a strong component of theory and focused on researchers and funders of research. And so didn't really leave a lot of space for people who were implementers or people who were outside of the US, to be frank.
There are, probably I'm not the right person to ask about barriers, but what I see, first of all, patients and people from communities, they have their own jobs. As they are active, but they need to make money somehow. So they cannot just leave their job for 4 days and come here, probably. Another problem and another barrier may be the price of attending the conference. I don't know if there is...
There's scholarships. They probably need to be invited.
Definitely, they need to be invited. They need to know about conference. I'm not sure if they yes, you are involved, but most patients, they don't know that such conference exists at all.
I host, write, and produce Health Hats the podcast with assistance from Kayla Nelson and Leon and Oscar Van Leeuwen. Music from Joey Van Leeuwen. I play Barry sax on some episodes alone or with the Lechuga Fresca Latin Band. I'm grateful to you who have the critical roles as listeners, readers, and watchers. Subscribe and contribute. If you like it, share it. See you around the block.